3 of our bones and soft tissue injuries notes and presentation. Just a review from the beginning, we talked about the axial skeleton being the green portion here with the ribs, the vertebral column, the skull, and then the appendicular skeleton being the purple portion here that makes up the bones of our limbs and part of our pelvis. Functions of the skeletal system. There are several of those that I think will be on your test. Your skeleton allows your body to move with the help of muscles and all of the other systems of your body. It will support and protect internal organs. For example, the skull protects the brain, the rib cage protects the heart and lungs. Your bones produce red and white blood cells. White blood cells are lymphocytes, which help fight off infections, and red blood cells carry oxygen around the body. Your bones also provide a storehouse for minerals such as calcium, which makes those bones harder and more dense. Bones are made up of microscopic cells. Those are called osteocytes. There's 5 types of bones. We have long bones. Here's a better picture. Long bones, for example, there's a humerus there. We have short bones. We have flat bones. We have sesamoid bones and irregular bones. Those are the 5 types of bones. Talked about, I think there's actually 7 types of bone fractures. The first was a simple fracture. Simple fracture can be complete or incomplete. The broken bones, the ends do not penetrate through the skin at all. This is a compound fracture. I think we watched the Kevin Ware, or we had that on Kevin Ware video. This picture here, that's a compound fracture. Fracture the end of the bones penetrate through the skin. There's a great chance of infection with a compound fracture there. Green stick fracture, that's in adolescents or children whose bones are slightly pliable still, and it breaks and it looks like this, like if you were to break a stick that is still has life to it. A comminuted fracture is when a bone breaks into 3 or more pieces. A stress fracture is a small, it can be incomplete break due to overuse, poor muscle balance, or lack of flexibility. Epiphyseal growth plate fracture. Here is the growth plates in an adolescent's hand. And the 7th one is an avulsion fracture. An avulsion fracture is where a fragment of the bone is ripped off. For example, it could be part of the tibia. It could be part of the femur. Acute management of fractures. Talked about internal and external fixations of broken bones. There's 3 different types of muscles. We talked about cardiac, skeletal, and smooth muscles. Cardiac is the heart, skeletal are attached to and move the bones, and smooth muscles are our intestines, our digestive system. There is an origin of every muscle. There is an insertion of every muscle. So where does it start? Where does it end? Where's the belly of the muscle? What is the blood supply? What nerves innervate a muscle? And then what is the action of that muscle? We are not going to learn all those things when we go through the muscles, but we will talk about them. You will not have to have them memorized in this class. We have prime movers and we have synergistic muscles. We talked about bicep. The bicep and elbow flexion as the prime mover. There are lots of synergistic muscles that help stabilize and support that movement. Antagonistic muscles work in opposition. So if we're talking about my bicep, the tricep is the antagonistic muscle. So extension is triceps, flexion is biceps. Muscle atrophy and hypertrophy. Atrophy happens when muscle tissue it dwindles away due to an injury or surgery. Hypertrophy is when you're lifting weights, you're working out, your muscles are getting larger. Muscle, we have muscle strains, muscle or tendon strains, and then we talked about ligament sprains. So first, the strains is where you strain a muscle. You can have a grade 1, 2, or 3 strain, which is the same as a sprain, but you have an acute or a chronic. Acute means it just happened. Chronic means it's something that's nagging over time. When muscle fibers are injured, well, this is how they start pre-injury. When there's an injury or the muscle is pulled or the tendon is pulled, it starts to look like this, and this doesn't feel good. Causes us problems. Then we throw down scar tissue just like you're throwing. It happens quickly. Your body will throw down scar tissue on that injury, which can be good, but it also can be hurtful or harmful to us as well. Treatment of muscle strains. We talked about sprains. Sprains happen to ligaments. There's 3 grades we talked about. So mild or grade 1, you'll probably still be able to play through the rest of that game. Grade 2, you may or may not be able to play. There's partial tearing of that ligament. And then grade 3, severe or complete rupture of the ligament on a sprain, ankle sprain. Tendinitis is an overuse injury, inflammation of the tendons. And this one example here is through the Achilles tendinitis. But you can have tendinitis in any of the tendons in your body. Remember, tendons attach muscles to bones. Injuries to the muscles, we had contusion. Those are bruises, which can lead to, this is a test question, this myositis ossificans. You need to know that. That's where there's a bruise that's not managed properly, and it kind of calcifies within the muscle. Bursitis. Bursitis is inflammation of the bursa sacs. I think this is where we're starting today. 5 soft tissue injuries. We'll go through abrasions, lacerations, avulsions, puncture wounds, and hematoma. Ecchymosis, I think we had on one of the slides yesterday, but ecchymosis is the medical term, just the bruising and the discoloration. So you can see that right here on this person's arm. All right, the first one is an abrasion. We've all probably had an abrasion from one time or another. We often call this a scrape. It's an injury that occurs when several layers of skin are torn loose or just totally removed, also known as a scrape. Treatment, you're going to wash it with soap and water, get it clean, removing the dirt and debris. Apply an antibiotic ointment, and then leave the wound open unless it's oozing fluid, or if there's blood, then you can put a Band-Aid on it. You might also, if you were cut by some metal, scraped by metal, you might check the date of your last tetanus shot. Should be given every 10 years. Some examples of abrasions. The next one is a laceration. A laceration is an injury that results from a tear in the skin. You can see here's a picture of a laceration. We call a cut. Usually a laceration is a cut. Once again, you're going to clean it with water. Make sure that there's no debris left in it. Get the bleeding to stop by applying pressure. And then if it's deep enough, like for example this one, we're going to need to get you to the hospital and get some medical attention. A physician should be contacted if the cut, so this is kind of your rule of thumb, if it's deeper than 1/4 of an inch or longer than 1/2 an inch. They may be able to put stitches in that and sew that back together. That'd be a difficult spot on your hand there because you move your hand so much that pull on that. But they can put stitches or sutures in some spots. If the wound is on the face, eyelids, or lips, if there is a deep cut on the palm, finger, elbow, or knee, you would also want to seek medical attention. Some examples of a laceration there. An avulsion. An avulsion is an injury in which layers of the skin are torn off completely or a flap of skin remains. I think I have a picture of that. You can see the flap of tissue here. Those are avulsions. After cleaning it, replace the flap of skin. We want to keep that intact because that can prevent bacteria getting into and getting infected in that wound. It will probably die and fall off at some point, but as long as we can keep it on, we want to leave it there. Don't rip it off. Puncture wounds, an injury caused by a sharp object that penetrates the skin. First, you need to find out if the object is still in the wound. If it is out, determine what tissue has been injured and take steps to prevent infection. Never remove an object this is sticking out of somebody, because if you do, the bleeding may start profusely. So leave that in and get them to the hospital. Example of puncture wounds, you can see there's a nail here. This is probably a stab. Hematoma. Hematoma is just the formation or the pooling of blood or fluid underneath the skin or in the tissue beneath the skin. Usually a result of a contusion, so a bruise. Treatment is typically local compression, padding, ice. Our body's response to injury. The first thing that our body is going to do is we take blood to the area. Our body sends extra blood because it knows there's an injury there, and that causes inflammation. We don't like inflammation because it doesn't feel very good, but inflammation is actually, it's our body trying to heal itself and bring nutrients to the cells. But that's your initial response, is just to swell or inflammation. The second is cell regeneration, which allows the wound to heal as they divide and replace the damaged cells. And the third is tissue remodeling. This is a point at which the cells and molecules are reassembled. Collagen fibers or substance, as in bone, are thickened and strengthened, and connective tissue, which support our connective soft tissue, replaces lost cells. and tissue. All right, so those were I believe there was 5 soft tissue injuries. Ligaments, we went through that.